In this module, we shall learn the indications and equipment for providing phototherapy as well as the maintenance and troubleshooting while using phototherapy equipment. Phototherapy in a preterm neonate is to be initiated based on the guidelines shown here. Start phototherapy at lower levels in a neonate with hemolysis, asphyxia, sepsis or clinical instability. Phototherapy can be given using compact fluorescent lamps that emit blue or white light or light emitting diodes. Fiber optic phototherapy with a Billy blanket can also be used. Compact fluorescent lamps or CFL units contain 6 to 8 short double folded tubes for delivering phototherapy. Some machines may have 2 white lights for observation. These are enclosed in a panel of reflectors. Using phototherapy machines with only white tube lights is not effective. Blue LEDs or light emitting diodes are as effective as CFL lamps. They consume less power, produce less heat and hence can be placed closer to the baby. Having seen the different phototherapy machines, let us now understand how to give effective and safe phototherapy. After switching on the unit, make sure that all tubes are working. It is important to ensure that the cooling fan is not covered. While giving phototherapy, cover the eyes of the neonate with an eye patch. Keep the baby naked, ensuring that the genitalia are covered. Keep the phototherapy unit as close as possible, up to 15 centimeters, ensuring that the neonate maintains normal temperature. We can increase the body surface area of the infant exposed to phototherapy by placing another phototherapy unit beneath or by the side of the neonate. If available, fiber optic phototherapy blanket can be used to provide phototherapy from below. Use of reflecting materials like aluminum foil or white cloth around the incubator or the radiant warmer bed is optional. It is important to keep the diaper as small as possible. It is also important to perform periodic checks of phototherapy units to make sure that an adequate irradiance is being delivered. The target irradiance while giving phototherapy is between 15 and 40 microwatt per centimeter square per nanometer. If irradiance is not optimal, it is important to replace tubes. It is also important to monitor the baby's temperature every 4 hours while receiving phototherapy. Phototherapy does not have to be continuous and can be interrupted for clinical care procedures and for feeding. It is safe to continue breastfeeding or breast milk feeding while the neonate is on phototherapy. It is important to ensure adequate hydration while the neonate is receiving phototherapy. However, please remember that there is no role for routine intravenous fluids or supplemental feeds unless the neonate is clinically dehydrated. Phototherapy is not free of side effects and therefore should be used only after checking the total serum bilirubin levels. Exceptions to this rule are neonates with signs of acute bilirubin encephalopathy or sick preterm neonates with significant jaundice on visual assessment. The side effects of phototherapy include rashes, diarrhea, dehydration, overheating, damage to the retina and separation from the mother. Make sure that you change the tubes every 6 months or if the usage time exceeds 1200 hours or earlier if they flicker or if the tube ends become blackened. ensure good air circulation to the phototherapy unit. And lastly, maintain cleanliness and ensure electrical safety.